Hello, this is Dr. Arroyo again, and I'd like to introduce my two companions in this video. This is TikTok and this is Twitter. Please don't mind them as they sit on my shoulder as we read through this. So we have gone through the foreword, and now let us proceed. What kind of doctor was Jesus? Jesus MD sounds a little odd, doesn't it? But should it? The New Testament contains more than 75 references to the healing work and ministry of Christ. Down through the centuries, one of the names his followers have traditionally used to refer to Christ has been the Great Physician. The term is every bit as orthodox as the Good Shepherd or King of Kings. Indeed, the image of Jesus as Great Physician could be even more instructive for us today. After all, how many of us, as we begin the 21st century, can personally relate to the ways and work of shepherds? Unlike the people of Jesus' day, and for many following centuries, we have little practical experience with sheep in their everyday care. Come to think of it, few of us have any first-hand knowledge of royalty either. Kings are even more rare than shepherds in our day and age. In contrast, there are many MDs today, many more MDs today than at any point in human history. The United States alone boasts 800,000 licensed physicians. Most of us are personally acquainted with many doctors and have probably sat long in more of their waiting rooms than we want to remember. So, perhaps the time has come when anyone who wants to better understand and follow Jesus will benefit from a closer examination of the life and practice of the Great Physician, Jesus Christ, MD. It's still as hard to imagine that name on a sign in front of a modern medical building as it is to picture a hospital name tag reading Dr. Jesus. Trying to envision him in a contemporary healthcare setting raises all sorts of interesting images and questions, such as, what kind of physician would Jesus be? I can almost hear the argument in the doctor's lounge now. There are representatives from numerous specialties, each one convinced with scriptural references to bolster his or her argument that they know for certain what kind of doctor Jesus would be, because he was clearly one of us. The orthopedist knows Jesus as a fellow orthopod. After all, he made the lame walk and the bowed to stand straight. That's in Luke 11 to 13. The internist notes that he healed people with heart failure. That's in Luke chapter 13, verses 2 to 4. The ophthalmologist counters, don't forget, he made the blind to see. Luke chapter 18, 35 to 43. A neurologist points out that Jesus cured a man with palsy. Luke chapter 5, verse 18 to 25. Our ear, nose, throat specialist reminds us that he caused the deaf to hear. Luke chapter 7, verse 22. The infectious disease specialist profoundly declares he cured leprosy. Luke chapter 5, verse 12 to 14, chapter 17, verse 11 to 19. Then the pediatrician quotes Jesus himself, who said, "Let the little children come to me." Luke chapter 18, verse 16. An elderly GP points out that great crowds came to Jesus for healing. Matthew 15 verse 30. Surely proving he must have been a general practitioner. A younger family practitioner thinks that scripture and others imply that Jesus dealt with whole families from young to old and worked in the community. Nobody is surprised when the psychiatrist cites Jesus' treatment of the mentally ill, Luke chapter 4, verse 33 to 36. Of course, the gynecologist mentions the woman with the issue of blood, Luke chapter 8, verses 43 to 48. Everyone laughs with a colleague fresh from the OR who says, Jesus must have had the heart of a surgeon. Note the boldness he showed in Luke chapter 19 verses 45 to 46 when he chased the money changers out of the temple with a whip. He rushed in where others feared to tread. He didn't carry a stethoscope. After reading Matthew chapter 5 verse 29 to 30, I'm sure he'd agree. When in doubt, cut it out. I always try to represent the opinions of my learned colleagues in medicine, even as I appreciate their expertise and sense of pride in their chosen specialties. However, when it comes to deciding what kind of doctor Jesus was, I would have to disagree with all of the conclusions reached in this imagined scenario. It's obvious to me that Jesus was a missionary doctor. You're probably thinking, wait a minute, weren't you a missionary doctor? Your opinion is just as biased as any of those medical specialists. Maybe. Our personal experiences usually do color our perspective. So here in this book, my observations and understanding of Jesus MD indeed will be shaped not just by my own career as a medical professional, but by my years as a missionary doctor. So humor me a little when I include some personal illustrations of the adventure and challenge faced by the medical missionaries today as we carefully examine the great physician together. I know that by thoughtfully considering the life and example of the great physician, I am repeatedly reminded as to what kind of physician my patients are looking for and what kind of doctor I want when I am a patient myself. More important, by looking at both the practice and the person of Jesus, I have begun to see not only what kind of doctor, but what kind of person I want to be. Thus, you don't need a white collar coat or a stethoscope to keep reading. This is not a book just for doctors and medical professionals. By looking at Jesus Christ as our model and personal mentor, I expect every reader, lay people and medical folk alike, to identify practices, principles, and priorities in Jesus' life, specifically in his role as the great physician, from which we all need to learn. We'll do that by checking out his appointment schedule, accompanying him on rounds, and observing his bedside manner. We will watch Jesus in his doctor role as he examines, diagnoses, and heals. We will learn as medical students have learned for centuries by observing one-on-one, a masterful mentor superbly practicing his profession. We will compare and contrast his practice with mine and some of my colleagues, looking for applications in our personal and professional lives. Sometimes even prescribing treatments will benefit us all. Together we will examine the great physician and look at him from a new perspective, through the eyes of a doctor. Hopefully, we will also let him examine us in the process. Let us see what we all can learn about our Jesus MD. There's no need to delay this divine appointment any longer. Thank you.